As this heat and humidity continues to climb, doctors say it's not just uncomfortable, it can quickly become life-threatening, especially for children, older adults, and anyone working outside. According to the World Health Organization, heat stress remains one of the leading causes of weather-related deaths worldwide. And new research published just this week warns heat-related ER visits and hospitalizations here in the U.S. could more than double over the next 15 years as extreme temperatures become more common. Joining us now is Dr. Jeremy Gagan. He's here with us, an emergency room physician with Community Health.
Yes, thank you so much for being here.
Thank you for having me.
Yeah, so this is something that sneaks up on a lot of people. What makes heat and humidity so dangerous?
Well, in particular, right now what we're dealing with, the human body cools through evaporation, sweating. And once you get above a relative humidity of about 75%, it becomes very difficult for the human body to cool off. And so what we're dealing with right now means any of those people that you had mentioned who are at risk, people working outside, the elderly, the people, those with chronic conditions such as heart disease or respiratory illnesses, they have a very hard time coping with these changes if they're not in a cool place.
We've heard there are things that we can do to stay cool, like wearing loose-fitting clothes, staying hydrated, of course, drinking plenty of water. What else can we do?
Well, it's really important to have a place to go that is cool and not just stay in wherever you are and feeling hot. Get into a place that's cool, find a cooling center, obviously have air conditioning if at all possible, or if you can't, have a fan, make sure those windows are open, things like that.
Yeah, I'm always trying to remind myself and my loved ones, drink before you're actually thirsty, just to try to stay in front of things.
And we also had up there, avoid alcohol. Why should we avoid alcohol in this
Well,
heat?
the alcohol is not going to be effective hydration. It's actually going to act as a diuretic, or in other words, make you go to the bathroom more and dehydrate you more than drinking water.
Okay.
Caffeine has a similar effect too, not as pronounced.
All right,
Look at us.
take a break with the Pepsi.
Okay. Also, talk to us about the warning signs that we should be looking out for.
So early on with heat, you're going to have a lot of, obviously you're going to be sweating, you're going to feel hot. When you start to see changes of mentation, when people are getting confused, loss of coordination, and oddly they might feel almost cold and stop sweating, those are the signs: confusion, not sweating. Get them to the emergency room. But first get them to a cool place.
All right, hopefully nobody gets to that point. Thank you so much, Dr. Jeremy Gagan with Community Health. Really appreciate it.